will have so many takeaways at the end of it that you will actually be thankful to yourself that you have attended it. It can prove handy to you and your family, near and dear ones. I'm here to introduce our subject expert, Lion Dr. Amee Agnihotri, who would be conducting the webinar on pelvic floor dysfunction in women. Dr. Amee is an accomplished clinical neurodynamics practitioner as well as an accredited McKinsey's mechanical diagnosis and therapy practitioner. She is a Bachelor of Physical Therapy and holder of Advanced Clinical Diploma in Women's Health Physiotherapy from USA. During her long and successful stint, she has received many awards and accolades, which includes even the Excellence in Service Award, the highest award from the Vice President and Prime Minister of United Arab Emirates and the ruler of Dubai, His Highness Sheikh Mohammed bin Rashid Al Maktoum. Pelvic floor dysfunction is as common as 1 in 5 ladies suffer from it very silently. Let us all come out and speak our troubles to Dr. Amee, who will help us understand and then address it so that none of us suffer in silence. Thank you so much, Dr. Amee, for all your time and expertise today. And we are all ears and waiting to hear from you. Over to you.
Good morning, everyone. Our President KK, team Deepa, Puneet, Lakshmi, I really want to thank all of you for always being there. I wish everyone happy Easter. And this is something which is very close to my heart, which is pelvic floor dysfunction, something which has been, I would say, not neglected, but people don't come out and talk about it. So let's get to it. Let's understand what is this all about and how we can treat. One thing I want to assure you, if it is treated on time, it is definitely treatable. So please come out, spread the word around. Whoever suffers, please don't suffer in silence. Come out and get yourself treated. So let's start. So this is what the topics are: the introduction, the anatomy and physiology, the functions, the prolapse of the organs, what are the symptoms, what are the causative factors along with it, how you can treat it. Then you have my contact, because I do offer professional advices and the references which I have used for the seminar. So the pelvic floor basically comprises of the muscles and the connective tissue. So what is pelvic floor? Pelvic floor is something which is attached to the pelvic bone in front, and which you can, I will show you once we go to the next slide, how exactly it is attached. It is a mixture of soft tissue, connective tissue, as well as muscles. This is the attachment to all the areas around the pelvis, front, back, and on the side. Okay. Basically, if you, all the humans, they definitely have a pelvic floor, but when it comes to the female, they have extra organs, which is like uterus, which is for the birth canal. And the chronic symptoms are basically because of the either hypotonic, means loose muscles, or hypertonic, means the muscles are very tight and contracted and they don't work well. So muscles which are either loose or too tight, they don't work well. And unfortunately, pelvic floor dysfunction is heavily underreported in so many people. And let me tell you, pelvic floor dysfunction happens in men too. So it is not that it just happens with the women. It is men also suffer. But women definitely suffer more because of the childbirth, because of the pregnancy, because of the hormones that we have. We definitely suffer a little bit more than the men. So let's get to the anatomy and physiology. How does it look? Right? So I will tell you, this is exactly how the pelvic floor will look if you look at it from the side. What is a pelvic floor? It is like a hammock. Okay, you can see it in the picture. So this is the toned pelvic floor. So imagine yourself sitting on a hammock which is loose. What is going to happen? You are going to sink into it. But imagine yourself sitting on a hammock which is tight, which is good, strong. What will happen? You enjoy yourself in that, right? So this is the difference. Let's go to the next slide, and I want to show you something, right? I'll stop the share for the time being. You can see it on the screen. How does it look exactly, right? So let's check it out. Okay, so this is how the pelvic floor will look from the front. These are your abdominal muscles. This is your diaphragm. Your lungs and the heart is sitting on the top. This is where your pelvis is. The pelvic floor gets attached to the front, the pubic bone, what we call it. Now let's turn it around. This is the spine, and at the back, it's again attached to your spine. There are attachments which are happening on the sides as well. Okay, and how does it look from the side? This is exactly how it looks from the side. If you see it from the side, this is how it looks. So this is where the pelvic floor is. And now I'll explain to you what happens is when you breathe in, this diaphragm, what we call it, this diaphragm gets pushed down. So can you imagine what happens to all these organs? All these organs get pushed down onto the pelvic floor. So what does it do? It holds itself tight and keeps all those organs in place. And when it has to, when we are breathing out, it pushes those organs up. The air gets expelled from the lungs out. So this works as a pump, like a canister. So this is why it is very important also in breathing. So don't look at it that just it is holding your, because you're able to hold urine or something. No, it works as a pump. It works as a pump for your lower leg, the legs, what we call it, the lower extremities. What does it do? This pumping action helps the blood flow to return back to your heart. It helps the lymphatic fluids which are there in your limbs to get back into the system. So this floor, it's a small structure, literally the size of your fist, this size, helps in a lot of functions. So this is what it is. That's why it is very, very important structure. And that's why we need to take care of it. So this is where we are. So this is the diaphragm, as I told you. These are the muscles. This is where sacrum, and see how it is attached, the way exactly I had told you. And this is how it looks. It looks like a canister. And you can see it, see the action. See the action while you breathe in and breathe out. So this works like a pump. There are two muscles, one on the top, which is a diaphragm, one down, which is a pelvic floor. And they work in tandem to help you breathe, to hold your organs in place, to help the venous return, and to help the lymphatic drainage. So what are the functions? A strong and healthy pelvic floor is very important. Why? Because it offers the support to all the organs which I showed you on the model. It supports the sphincters of the urethra, of your digestive tract, especially even in the females, it supports the birth canal. It holds it in place. So these are very, very important functions of the pelvic floor. You need to have a very strong pelvic floor, and you can see the relation of a pelvic floor to your core muscles. See how they are. There are lots of connections going on through the fascia, through the connective tissue, to all the muscles in this area. So there's a connectivity which is happening here. So your core and your pelvic floor have to be strong, and they have to work in tandem. What happens is when you're coughing or you're laughing or you want to lift something, right? The pelvic floor has to contract and hold all these organs in place. So it withstands a lot of pressure. Like, can you imagine you're moving a box which is heavy? So you have, what you do is you increase the pressure in this area so that you can hold it and you can move it. So that's what it is all about. Okay, so this is what it does, is it withstands very high pressure, and that's why it has to be really very, very strong, so that while doing any of these activities, you do not leak urine, or you don't feel that your uterus is moving down or your rectum is moving down. It's very important. So these are the functions of the pelvic floor. It supports the pelvic organ. It controls the bladder and bowel movement so that you do not have leakage. It has to be under your control when you want to go to the washroom, or when you want to pass motion, or even you want to pass urine, right? This is what I was talking about, passing of the urine and feces. There is sexual function and the breathing function, which I explained to you. most important as far as females are concerned is pregnancy and childbirth. You can imagine during pregnancy, there are a lot of changes happening in the body. There are a lot of hormonal changes. There are a lot of physical changes. There are a lot of anatomical changes which happen in the body. And those are all happening in that cavity, right? And all this load is taken by your pelvic floor. The baby's size is increasing, you put on weight. So all that is happening and all that is controlled and all that is taken by that small pelvic floor. Correct? And second, it's not just in the during the pregnancy, even in the childbirth, pelvic floor helps because it controls that movement, right? The next one. Now, what are we looking at? We are looking at what happens if your pelvic floor is not toned or not strong, right? This is the normal anatomy of your body. This is where your bladder is sitting. In the female, this is where the uterus is. This is the birth canal. This is your rectum, right? So now, most important thing for everyone, if anybody has a constipation, please get it treated. If anybody has any urinary issues, please get them treated because you can see what happens in this. Now the next slide, or next picture, what it is a bladder prolapse. We call it a cystocele. This bladder prolapses into the anterior wall of your birth canal. Why? Because it is not strong. Generally, this anterior wall of the birth canal holds the bladder in place. It doesn't allow it to collapse onto the anterior wall. But if that anterior wall is weak, this is what happens. The bladder which is full collapses. It not just collapses, it is coming out. It is called a cystocele. There is something called a urethrocoele. You can see the urethra, that there is a tube which comes out from bladder which allows us to pass urine. Sometimes this tube, because of the pressure, it comes out through this opening. It is called a urethrocoele. Okay, then what we have is, this is here, it's called a rectocele. As I was telling you, as I was explaining to you, that if you have a chronic constipation, right, what happens is there is too much stress on the muscles here. There is too much stress on the sphincter or a valve, what we call it. Okay, and because of this, they keep pushing onto the posterior wall of your birth canal. Okay, and this one, the rectum, will prolapse. Prolapse means a descent of an organ. Prolapse is not something which is normal. It is a descent of an organ which is not supposed to happen. So this one will prolapse through the opening. And this one is coming out of your other end of the gastric canal and you can physically see it. Okay, so this is what happens if you have chronic constipation. This happens if your anterior wall of a birth canal is weak. This happens if the posterior wall of your birth canal is weak. So you can imagine how important this wall is. It holds everything in place. And the pelvic floor which is here, there is a valve here, there is a valve here, and there is a valve here. So these are all the valves which act as openings and it allows the movement in one direction. Now, what happens if there are multiple childbirths? What happens is this area of the uterus, which is called the cervix, which is the opening to the birth canal, becomes weak because we do not follow postnatal program. The postnatal program is something very important and every woman must follow. Be it a cesarean section, be it a normal delivery, you need to follow. And especially when it comes to a normal delivery, because all these muscles have been used during your birth, the child's birth, all these muscles get used. And if they are not, if you don't work on them, if they don't come back to their toned stage or the strong stage, what happens is the uterus slowly starts descending through this canal. This is, of course, a stage where you definitely require a surgery. But there are stages where the uterus has just started descending. The uterus has not come out. So there are different grades, what we call it, of prolapse, grade 1, grade 2, grade 3. They will all depend on how good or how bad your muscles in the pelvic floor are. So what are the symptoms? The symptoms of, and let me tell you, many women are asymptomatic. Okay, so that's important to know the prolapse symptoms. It may not correlate to the structure that has descended. So if you have the structure, might have been descended more, but you don't still feel the symptoms. You don't feel that there is heaviness, or you don't feel there is urine. You can't control your urine, but that does not mean you do not get yourself examined, right? So you can imagine that Paris women, when the one woman a childbearing age, that's what we call a Paris woman. So 50% of them have an observable pelvic organ prolapse, but only 10 to 20% are symptomatic. So the majority remains asymptomatic. They don't show any signs of having a pelvic organ prolapse. So that doesn't mean that you don't have it. It's better once you cross 40, 45, ideally, you should definitely get yourself checked. Get checked by the gynecologist. If you have any issues, please get it sorted, right? So what are the symptoms? You feel heaviness. There is heaviness. Why? Because the pelvic floor is not able to hold or contain those organs in that space. It doesn't have that strength. So you can feel the heaviness around your lower tummy area and the genitals. A dragging discomfort in the lower, you feel that something is coming out. You feel that there's something dragging you down. There could be muscle spasm happening because the muscles are getting tired holding those organs. You can feel as I said, there's something coming down. You feel like you're sitting on your rectum. You're feeling sitting down something on your bladder. You can feel it, and trust me, you do feel it. I've had patients who felt it. Or you can see, as I said, you can see or feel a bulge or a lump coming out. I had shown you the pictures how it happens. So when it is anteriorly, it's the urethra, it's a bladder. When it is posteriorly, it is basically your digestive tract. So this also could be one of the symptoms: discomfort and numbness during intimacy. The problems in passing urine. What happens is either your bladder doesn't pass it fully, or what we call it, there are different types of incontinences, as we call it. It's a stress incontinence. So on any physical stress, coughing, laughing, moving, heavy things, you could pass urine. There is urge, that you have an urge to go to the washroom, but there are times, unfortunately, you don't reach, and there is a leakage. Then there is a mixed incontinence, because of the or different reasons, of course, but majority of the ladies I have seen have mixed incontinence, urge, stress. Sometimes the urine is, or it is called there is another one which is called an overflow. What happens is, generally what we produce is about 0.5 to 1 ml per kg per hour is the amount of urine that we produce. So it will all depend on your body weight, how much urine you will produce per hour. Okay, so generally within 4 to 5 hours, we should go to the washroom, right? But sometimes what happens when it is overflow incontinence, the bladder doesn't empty itself fully. There is some residual urine, some volume of urine residual remains in your bladder. So what happens is that it keeps leaking, right? So this is what happens. So what are the causative factors? Please check. Increasing age. Why increasing age? Because with the age, generally the muscles become loose. Especially what happens with the women is the hormonal changes. Once you have hormonal changes, once you are postmenopausal, generally the hormones which keep all those structures intact, tight, they become loose. Right? So it is on us, the onus is on us to make sure that we work very hard, we exercise well, and keep those structures in place. If your BMI is over 25, if you have chronic cough and chronic sneezing, what happens is, every time you cough or you sneeze, you are increasing the intra-abdominal pressure. You remember I showed you the structure, I showed you the model. So what happens is, every time you want to cough, the abdominal wall has to hold all those organs in. So that is what happens. So we have to be careful while it is how to engage your core and your pelvic floor while you cough or you sneeze, right? Chronic constipation. It's one of the biggest causes. People need to treat it and treat it on time. Please do not delay. Then you have a family history of pelvic organ prolapse, or some ladies, what I have seen is they have laxity of their connective tissue. So let me tell you what is a connective tissue. A tissue which connects two parts, two organs. It could be lung is a connective tissue, so is your skin, so is your bone, so are your muscles, so are your fascia, so are your tendons, right? So if you have a laxity which comes genetically, you might have a lax pelvic floor by birth. Like you will have it. That's why you need to work harder. During vaginal delivery or normal delivery, what we call it, the pelvic floor takes a lot of stress, right? Literally, as we used to say to the patient, every time a child is delivered, he comes with some part of the mom with him or her, right? A forceps delivery. A forceps delivery happens when the child is not been able to deliver normally through your birth canal. Or sometimes what happens is when the child is being delivered, just before the child is able to coming out of the pelvic canal, what happens is they need to make a surgical incision on the outer opening of the birth canal to assist the delivery. Sometimes it happens instantaneously. Sometimes the gynecologist will take a call and make the surgical incisions to help deliver the baby. This is possible and this happens and this is very normal. They had done what they do is they will surgically stitch that wound, but that wound still remains. So now you can imagine that is a wound happening around the birth canal. When that wound happens, it heals with a fibrosis. What it does, it shrinks the tissues around it. It makes those structures a little weaker. So it comes on us to make sure that the structures are brought back to their original form. When it comes to the cesarean delivery, what happens is the cesarean scar which is there, it can get adherent or it can get stuck. And there are cases which I have seen. So what generally I advise to my patient is once the stitches dissolve, please mobilize your scar. There are ways of mobilizing your scar. There are techniques what I teach my patient what to do. The scar needs to be mobilized so that when it comes to the next delivery, your abdominal wall is free. It doesn't have those adhesions. Because every delivery, successive delivery with the cesarean section, the abdominal wall can get adherent and not as mobile as we want it to be. Sometimes during the delivery, the pelvic floor muscles could be torn, right? Then having hernias, hemorrhoids. What happens with hernia is, if you remember, I showed you the model and I had opened the abdominal wall. The abdominal wall in the center is called a linea alba or diastasis recti, as we call it, because two sides of the abdominal muscles join together in the center. That becomes weak during the pregnancy. So what happens is something which is joined and holds all those organs in becomes weaker and kind of opens up. Then what happens? There is a chance that you could have the intestines, you could have anything which is going to come out through this opening, which is called a hernia. Sometimes you have a umbilical hernia. The hemorrhoids is called piles in the normal terms. So if you have piles, be very careful, get them treated. You could have varicose veins, get them treated as I told you, because pelvic floor helps in draining the blood from your lower legs to your heart. Lymphatic drainage. So if you have swelling, if you're swelling on the legs, please don't neglect. Pelvic floor does the job of draining that fluid back to your system. So these are all the causes, as I've said. Age, definitely. Pregnancy and childbirth. When it comes to men, the prostate surgery, because prostate is in very close contact with your urinary bladder. Okay. Genetics, yes. If you have, as I said, if you have genetically predisposed to have tissues which are lax, then you have more chances of getting pelvic organ prolapse, and you should treat it on time. Hysterectomy, as I said, either cesarean section or hysterectomy. Why hysterectomy? Because the structure supporting uterus around are being removed along with the uterus. So your connections that you have to the pelvic floor, part of the connections get lost because they have to remove it through the surgery. Okay, pelvic floor injury, as I said, avulsion during childbirth, definitely. Secondly, increased intra-abdominal pressure. So when you are lifting heavy weights, when you are coughing, chronic cough, chronic sneezing, these are the time your abdominal pressure is all the time increased. You understand? So the abdominal muscle, all the organs in the abdomen are sitting on the pelvic floor. There's a lot of pressure coming on the pelvic floor at that time. Okay? Constipation, intense physical effort, as I said. Obesity. Why obesity? Because especially in women, what happens is slowly over the period of time, more fat gets collected around the lower abdominal area. All this fat, lower abdominal and can, all this fat is putting lots of pressure on the pelvic floor. The muscles, because the muscle by itself is weak, strong. But if you have muscles layered with fat, the muscle doesn't function well. The muscle becomes weak. So that's why obesity, BMI above 25, as I said, needs to be treated. Get active, do something about it. History of back pain. There is one cause. What happens with the history of back pain is there is a muscle which is a very small muscle inside the pelvic floor. It's called piriformis. And there's a specific syndrome which is called a piriformis syndrome, right? But people do, you can say, mistake it for the sciatica. Why? Because this particular muscle is lying on top of your sciatic nerve. So sciatic nerve comes like this, and this muscle is direct contact with the sciatic nerve. So when this muscle gets affected, the muscle will irritate the sciatic nerve and you feel it's a sciatica. But there are ways of testing it and there are ways of treating it. So you will have back pain, but you will not find the disc, you will not find anything. Even if you do MRI, you don't find it. So before doing all that, get your piriformis checked. If the piriformis syndrome is there, you check it, you treat it, you will not need any other problem, right? Let's go to the next. So what is the pelvic floor muscle training? See, you don't feel the pelvic floor normally, right? But how do you want to understand where is my pelvic floor? So when you go to the washroom, what you do, if you are passing urine, try to hold it in the mid floor, okay? Or pass the urine saying what? Dubai 1, Dubai 2, Dubai 3, Dubai 4, right? So you should be able to control your urine flow almost till you reach Dubai 10 or 15. So this is your control. This is when you will feel that where the pelvic floor exactly is, right? And it has a skeletal muscle. Why we call it a skeletal muscle? Skeletal muscle is the muscle which is between the bones. As I showed you the model, there is a pelvic floor, pubic symphysis, which is in front, and at the back you have a tailbone. So the pelvic floor is hanging between the two, like this, like a hammock, right? So that's why it's a skeletal muscle, and that's why it can be trained. Okay, so the same what you have in your quads, you have it in your shoulder, you have it in your back. The same thing can happen. The injuries, weakness, trauma, you can have it on the pelvic floor. Now, what happens is sometimes due to irritation, the muscle becomes chronically contracted. It becomes too tight. Then what happens? Can you imagine your back muscle is very tight? You know how irritated you are? The muscle is not able to relax. If the muscle is not able to relax and go to its normal length, the muscle cannot function normally. The muscle's function is compromised. So same thing, you can imagine your back is in spasm. You're not able to stretch, you're not able to move, you're not able to sit long time. The same thing happens to the pelvis floor. It's a skeletal muscle. if it is in the chronic contraction, you're not comfortable. The muscle doesn't work well. Okay, so that's what I said, that it involves tensing and relaxing. It has to be both ways. The muscle should be able to contract fully. At the same time, it should be able to relax and open up fully so that the next contraction is useful and functional. So, but my sincere advice to everybody, please do not self-diagnose. I can understand Google is very good source of information, but please don't self-diagnose. Don't suddenly start out doing something just because somebody else is doing. Seek professional help. Get yourself diagnosed properly. There are certain tests you which might have to do. We call it a urodynamic study. It's a specific study done for the bladder to see how it functions. And then please go to a woman's health specialist physiotherapist. So what is the treatment? Basically, it's hypotonic muscles, means the loose muscles, or hypertonic muscles which are too tight and overactive. Both ways it's wrong. The muscle needs to have optimum length and optimum relaxation, like all the other muscles in your body, like your quadriceps, like your quads, like your biceps, like your triceps. It's exactly the same. The principle is exactly the same. Only thing is the way of treatment or the way of training is different. That's all, right? Because what happens is, if you strengthen your pelvic floor, it has a good support for your bowel, it has good support for your uterus, it has a very good support for your bladder and your abdominal organs. So as I said, it is helping reduce the urinary leakage, incontinence, pelvic floor pressure, back pain. Okay, so idea is to inhibit the involuntary contractions, inhibit the incontinence, inhibit the leakage, not allow the uterus to prolapse or to descend in the tract, not allow the rectus to come out of its normal position and be descending outside the body. Okay. So what is the treatment? Is to relax the pelvic floor muscles, make their mobility easier and get more control. So the common treatment what I use, I have developed a program with the training which I received during my diploma, is a 9-level program. It's a different level of resistance, and each level you have to complete that level to go to the next level. So when a patient comes to me, I thoroughly assess the patient. I get the urodynamic report done from the gynecologist or the urologist. I have my own physical assessment form which I check. If need be, I do an internal examination which I'm been trained in. There could be a pubic symphysis disruption, which I have shown you, where the pelvic bone, where the in front of the pelvic, where it is getting attached the pelvic floor, that bone disruption occurs during a normal childbirth, or a tailbone which goes, you can say, maybe in the layman's term, it becomes crooked during a normal childbirth, because a difficult labor, what we call it. So that particular tailbone problem is called a coccydynia. So these two issues also might occur, and these two issues hamper the functioning of the pelvic floor. Though the pelvic floor could be normal, but because they are skeletal muscles and the two ends where they are attached, those ends are inflamed or not in a proper position, the pelvic floor cannot function well. Of course, there are surgical options if the treatment is not done on time. There are pharmacological options as well, like a drugs what you need to take. There are definitely options, but the idea of this webinar is to try and avoid the surgical options. Let's not get to the level where you need a surgery, because every surgery has its complication. It is not, nobody is going to tell you that no, every surgery is 100% successful. It doesn't happen. There are complications, there is scar, there is fibrosis, all of these things happen. So this is what is going to happen. So let's not get to that stage. Let's treat ourselves on time. Now there are a few exercises which I advise to my patients. There are of course many more, and they are all depending on the stage the patient comes to me, the level of prolapse, the power of the muscles, the patient's physical state, the patient's activities, the patient's profession. So it's a complete assessment form which I do. I assess the patient, and let me tell you, pelvic floor doesn't only affect you physically, it affects you psychologically, it affects you socially. You don't want to get into the society because you're too scared that you will not reach the washroom. You try to isolate yourself because you don't know what will happen next. So can you imagine the impact it has on your psychological state? It's huge impact. You lose your confidence. You don't want to go out in public. You don't want to meet people. You are not comfortable because you don't know whether you have a washroom close enough for you in case you need to rush. And secondly, people, what they do is when they are not comfortable, they stop drinking water. Please do not do it. Your water intake has to remain normal. There's a treatment to treat your pelvic floor, make it strong. But please do not reduce your water intake because you could land up with urinary tract infection. And second, very important, constipation, which becomes very difficult to treat if it becomes chronic. So please do not reduce your water intake. It needs to be as normal as you can. This is my contact. If anybody wishes to contact me, I do offer professional services for the pelvic floor dysfunction, and these are the references which I used for my webinar. I want to thank all of you for taking time out on a busy Sunday, especially the Easter Sunday, coming and attending the webinar. Now, I think as Puneet said, we will be opening this forum for question and answers. So over to you,
Yeah.
Puneet. Thank you.
Yes. Thank you, Doctor. Thank you so much for such an informative session. And before we dive into the Q&A, I mentioned in the beginning that we have our international representative, Line Augusto Di Pietro. He was facing some technical issues. He's in now, and I will request him to just address the crowd quickly before we jump into the formal Q&A session. Augusto, up to you, please.
Okay, can you hear me?
Yes.
Yes,
Yes.
Dr. Amee, Lion Amee, a great lion and a great doctor. Thank you very much.
Thank you so much. It's very kind of you.
For expressing such, I must say, a problem which people tend to leave behind and rather have to cure with surgical treatment, which is not the case because as you exhibited today, there are many, many solutions before getting down to surgical. So a big thank you goes to you. I must say that these are those aspects that we think very important, the awareness towards our personal health, especially after having gone through 2.5 years, 3 years of COVID pandemic, which our bodies and our mental health has suffered a lot. So the fact that you're bringing up these problems and making us aware of the various problems that we can go up against is always very important. So a big thank you to you, and I hope you come up with some further other awareness campaigns which can help us on our daily mental and physical health. Thank you very much for your insights, and I'll be seeing you soon. Thank you to all for assisting Dr. Amee's presentation and webinar. I'm sure you must have all enjoyed it and taken the right indications from them. A big thank you to the Dubai Emerald Lions Club for organizing such lovely events. I know it is Sunday, I know it is Easter Sunday, but it's always important to be out there. And as our motto, we serve. That's the most essential thing. So a big thank you to President KK and to the whole PST team. Have a nice day and my regards.
Thank you.
Thank you so much, Lion Augusto. Appreciate your time. So as we mentioned, now the presentation is over. We'll open the session for Q&A. If you have any question, you can raise your hand. I'll see it. I'll unmute you. You can ask your question verbally on the phone here, or you can write your questions in Q&A section, and we'll pick it up. So let me see if anybody has raised their hand. Not yet. I have somebody who's raised the hand. Lakshmi. Lakshmi Srinath. Lakshmi, go ahead. You can unmute yourself.
Yeah, thank you so much, Dr. Amee. It was indeed very, very informative. And I think the timing couldn't have been better. All of us have been kind of sitting at home and now getting back to exercising and getting back. So we should not overexert ourselves as well. That's one thing I thought. What about Dr. Kegel exercises? I've heard those are the ones which
Yes.
are important for.
Yeah, the thing is, because see, since it's been, you can say, advertised more on the Google, it's been marketed more on the Google, but Kegel's aspect is just contracting the muscles. The problem is Kegel doesn't address if you have an overactive pelvic floor, then what do you do? You understand? Because pelvic floor is not just one layer. It's the layer over the layer. There are three different layers of the muscles, right?
Right.
So it is not just the contracting. It doesn't see only thing that when it comes to Kegel, they do not take care of your core. They do
I
not take
see.
care. They do not take care of your breathing. They do not take care of the piriformis. They do not take care of your back muscles. Kegel only concentrates on the. I have nothing against it, but when it comes to the broader picture, Kegel is a very small part of it.
Got it. Thank you.
So
So I
that's
think
why I
we have to
said,
take it.
please do not
Got it.
treat yourself. Please do not self-diagnose. Leave it to
Right.
the professionals. This is what I meant. I have nothing against it. Trust me.
Sure. Thank you so much, Doctor.
Thank you, Lakshmi. Thank you, Doctor. We have two questions in the Q&A screen. I'm going to read it out for Doctor. She can address. Sunita Ramakrishnan, she has asked if you can explain some simple exercises.
See, now the thing is, it is very difficult to explain the exercises. Why? Because it is an individualized program. It's designed for every patient, and it depends on the problem that the patient has. What is the degree of prolapse? If she has a prolapse, what are the other associated problems? Does she have a genetic laxity of the connective tissue? There are many issues associated with it. It has to be assessed individually, and it has to be made an individually designed program. So it is very
Sure.
difficult for me to tell you. One thing only I could tell you is, if anybody knows what is a Viparit Karni, where you go and lie down by the wall and keep your legs up over the wall, right? That's the only thing which is safest for everyone I could advise. But please seek proper professional advice. Please do not try to treat yourself with this, because this could this will not help you when it comes to the particular problem, since you are not addressing the problem.
Sure. Okay, thank you. And I'm going to read out the second question. After that, we have a hand raised of Preeti Jain. I will unmute her after the question. The question is from Gauri Ramesh is about how can we take an appointment? So basically, this is for you, doctor. She wants to take an appointment with you. So if you can answer
Gauri,
her.
you have all my contacts, so you are most welcome to call me anytime you feel like. It will be my pleasure to help you.
All right, thank you. And I am now unmuting Preeti Jain. She has a question for you, doctor.
Yes, sure.
Hello.
Hello.
Hello, Dr. Amee. This is very useful information. I really didn't knew about this because a few months back I really faced the problem, and I'm obese. I have constipation, and suddenly I realized while talking on phone, I was laughing, couldn't control the urine. There was some leakage. So I consulted a gynae. My sister itself is a gynecologist.
Correct.
She's working. I told her about my problem, and she told me that I should exercise. I should search on YouTube regarding the exercises. And I do see this Kegels exercise that lady mentioned on
Correct.
YouTube. I don't know how big my problem is. I don't know because I don't feel anything else other than this problem. So what do you suggest? Should I undergo some test or something to to reveal what is my what is the extent of my problem?
Yes. See, the thing is, as you said, as I had mentioned in the first few slides, most of the patients are asymptomatic unless and until they feel the urine leaked or something else happened. They do not come to know that the pelvic floor is weak. So that's what it is. Get yourself first tested properly. Okay. Get your urodynamic study. You can definitely contact me. You need to follow a proper rehab program. Once you follow the rehab, because see, it will depend on what level you are. The exercise level are 1 to 9, right? There are different resistance levels.
Yeah.
So each one will depend, each level is programmed and each one is individually programmed. I do not do a general program. It will all depend on the patient's condition, what my findings are, because I do a proper full assessment of the patient. After that, I design a program.
So are you working in Dubai itself?
Yes, I have home services license for myself.
Okay.
So I do go to patient's home and I treat them.
Okay. So I have your email ID. I can write it to you.
Yes, please. You're most welcome to do that. Please do
Yeah.
not neglect. You have a chronic constipation. You are on the heavier side. Please don't neglect it.
Yeah, sure. Thank you so much,
Most
Dr.
welcome. Most welcome. I'm very happy that you ladies are coming out and talking about it. This is what was the takeaway of this webinar.
Thank you so much to both of you. I will move on to the next. We have got a couple of questions in Q&A again. I don't have the name. It just says Zoom user. Hello, doctor. Would like to know, can this be treated with exercise?
It can definitely be treated with exercise if your prolapse has not gone to the level 3 or 4. That is what I said. It needs to be diagnosed first. It needs to be assessed first. Once it's assessed properly, we can definitely make sure that it doesn't go to that level where you need a surgical intervention. So it can definitely be treated by exercise. I've treated patients, and by God's grace, 90% of my patients managed to avoid to go to stage 3 or 4 and they avoided operations.
That's a positive update. Perfect. Okay, thank you again. And the last question that I have is, again, I don't have the name. It's just showing the phone model, Galaxy M51. Thank you for a wonderful session. Please, what is the muscle above the sciatica and one linked to backache? What about them?
There is a muscle which is called, I don't know how to explain, because piriformis we call it. Okay, that's a very deep muscle in the pelvic floor. It connects the pelvic floor to the hip. And what happens is, why it is important when it comes to diagnosing the back pain or a sciatica especially, because this muscle is in a close contact with the sciatic. So this muscle is sitting here and the sciatic, I hope they can see it. The sciatic nerve passes right through this. So this is how the sciatic nerve passes. Okay, the muscle is in close contact. So if this muscle is contracted or this muscle is inflamed, it irritates the sciatic nerve, and the nerves are very sensitive. So any irritation of the muscle, any structures around it get irritated, and you could feel pain coming down, tingling coming down your leg, which may not be sciatica at all. So this is what I was talking about.
Perfect. Thank you, doctor. Hope everybody's got their answers. I have one more question which has come in the chat from Seema Sambargi. It says, are you available for online consultation, doctor?
These consultations, yes, I'm available for online consultations, but these consultations are better done in person because I need to know what your present condition is, what kind of a program you will need, and the outcome. I can definitely do an online session. It's not that I cannot, but it is difficult because this is something where your physical presence is required. I hope I've answered the question.
Yes, Dr. Amee, you have answered many of our questions. And I think we're just waiting for Puneet to come back in. Hey, Puneet.
Yeah, I was talking all on mute. Okay. Okay, thank you so much, Doctor. And I really like the fact that it was a very interactive section. A lot of people asked their questions, which shows that the subject was relevant. They needed some, advice, and I hope they will uh, get a good takeaways from this presentation that Dr. Amee has presented, and also advise some exercises. She has shared her contact email ID in case you still need to get in touch with her for any appointment. Please feel free to do so. And now we'd like to wrap up the session. We are on time. Unless anybody has still any questions, because we have a couple of minutes, we can still take up any question you may have. Okay, don't think so. Perfect. Thank you so much, guys, for taking time out on this Easter Sunday. It shows that you also, were looking forward to this. It was relevant, and we will keep coming out with different webinars, or maybe going forward now in person, lectures and awareness programs on different topics. Thanks to Dr. Amee especially for putting this together.
It is really my pleasure, and thank you, KK and the team, for giving me an opportunity to come out and make people aware, because this is something which people do not talk about. It becomes like a taboo, but something which can be treated, something which needs attention. I'm very happy the ladies came out and they talked about it. Girls, you rock.
Thank you, Dr. Amee. Great presentation. Thank you.
Thank you. With this, we'll wrap it up. Thank you so much. Have a good day, everyone. Thank you.
Have a good day, everybody. Happy Easter.
Happy
Easter.
Easter to you, Dr. Amee.
Happy
Thank
Easter.
you, Dr. Amee.
Thank you, dear.
Happy Easter, everyone.
Thank you, Dr. Amee. Happy Easter to all of you.
Yes, thank you.
Bye-bye.
Bye.